Welcome. Today, we're delving into the world of fungal infections affecting the lungs, with a particular focus on mucormycosis, often impacting the nasal and sinus regions. This is a serious infection, and understanding it is crucial for early detection and effective management. Join us as we explore its causes, symptoms, diagnosis, treatment, and prevention. So, what causes these fungal infections? Often, they arise from inhaling fungal spores present in the environment. These spores are commonly found in soil, decaying organic matter like leaves and compost piles. Mucormycosis specifically is caused by a group of molds called Mucormycetes. While these fungi are everywhere, they typically don't cause disease in healthy individuals. However, those with weakened immune systems, uncontrolled diabetes, or other underlying health conditions are far more susceptible. Let's break down the pathophysiology, how this infection unfolds in the body. Once inhaled, fungal spores find their way into the lungs and sinuses. In individuals with compromised immune defenses, these spores can germinate and rapidly multiply. Mucormycetes have a predilection for invading blood vessels. This vascular invasion leads to thrombosis or blood clots, restricting blood flow to the surrounding tissues. The consequence is tissue death or necrosis, which can spread aggressively from the sinuses to the eyes and even the brain, resulting in devastating complications. Now, let's consider the epidemiology. Who is most at risk and how common is it? Fungal lung infections, including mucormycosis, are relatively rare but are becoming increasingly recognized, especially in certain populations. Individuals with uncontrolled diabetes, particularly diabetic ketoacidosis, are at significantly higher risk. Other risk factors include hematological malignancies like leukemia and lymphoma, organ transplantation, stem cell transplantation, prolonged corticosteroid use, iron overload, and skin trauma such as burns or surgical wounds. The prevalence can vary depending on geographic location and the specific risk factors present in a community. What are the telltale signs and symptoms? The presentation of fungal lung infections can vary depending on the specific fungus involved and the extent of the disease. In the case of mucormycosis affecting nasal and sinus regions, common symptoms include facial pain or numbness, nasal congestion, sinus pressure, fever, headache, and a blackish discoloration of the nasal or palatal tissue. Pulmonary involvement may manifest as cough, shortness of breath, chest pain, and fever. It is crucial to seek medical attention immediately if you experience these symptoms, especially if you have any of the risk factors we discussed earlier. How is a fungal lung infection diagnosed? Diagnosis typically involves a combination of clinical evaluation, imaging studies, and laboratory tests. Imaging techniques such as CT scans or MRIs are essential for visualizing the extent of the infection in the lungs, sinuses, and surrounding tissues. A definitive diagnosis requires identifying the fungus through microscopic examination and culture of tissue samples obtained from biopsies of the affected area. Specialized stains and molecular tests can help to confirm the diagnosis and identify the specific fungal species involved. While numerous types of fungal lung infections exist, when discussing mucormycosis, the focus is primarily on the location of the infection. The rhino-orbital cerebral form, affecting the nose, sinuses, eyes, and brain, is the most common and aggressive. Pulmonary mucormycosis involves the lungs, while cutaneous mucormycosis affects the skin. Disseminated mucormycosis refers to the spread of the infection to multiple organ systems. Treatment for fungal lung infections is often aggressive and requires a multi-pronged approach. The cornerstone of treatment is antifungal medication, typically administered intravenously. Amphotericin B, posaconazole, and azoconazole are commonly used antifungal drugs. Surgical debridement, which involves removing infected and necrotic tissue, is often necessary to control the spread of the infection, particularly in cases of mucormycosis. Controlling underlying conditions, such as diabetes, is also crucial for successful management. Reversal of immunosuppression, where possible, improves prognosis. A collaborative approach involving infectious disease specialists, pulmonologists, surgeons, and other healthcare professionals is essential. Preventing fungal lung infections, particularly in high-risk individuals, involves several strategies. Maintaining good hygiene practices, such as frequent hand washing, is important. Avoiding exposure to environments with high concentrations of fungal spores, such as construction sites and areas with decaying vegetation, may be beneficial. For individuals with compromised immune systems, strategies to minimize immunosuppression, such as reducing corticosteroid dosages when possible, are crucial. Strict glycemic control in diabetic patients is essential for reducing the risk of mucormycosis. Prophylactic antifungal medication may be considered in certain high-risk situations, such as in patients undergoing stem cell transplantation. The prognosis for fungal lung infections can vary significantly depending on the specific fungus involved, the extent of the disease, the patient's underlying health status, and the promptness of treatment. Mucormycosis, in particular, carries a high mortality rate, especially when it affects the brain. Early diagnosis and aggressive treatment are critical for improving outcomes. Recent research is focused on developing newer antifungal drugs with improved efficacy and tolerability, as well as exploring novel therapeutic strategies, such as immunotherapies, to enhance the body's immune response against fungal infections. Researchers are also investigating more rapid and accurate diagnostic tests to facilitate earlier detection and intervention. Thank you for joining us on this informative journey. Remember, early detection and proactive management are key in battling these infections.